Sleeping on the back is something that some folks think is important, and there's a lot of people who I respect really do like this. Harvey Stoller was an orthodontist back in the 50s, and he thought it was really important to sleep on the back. And one of my mentors, Jack Lude, who passed away a few months ago, he was an orthodontist who loved orthodontics, and he always wanted his patients to sleep on the back because it wouldn't distort the face because you're sleeping on one side or the other. Also, it helps promote good posture because your shoulder blades go back, okay? However, if you have a small mouth like mine, if you have a small box and you sleep on your back, your tongue's going to fall in the back of your throat. So many of us don't have a big enough mouth to sleep on our back. So our body's going to figure that out, and we are going to sleep on our side. And our bare way is going to be better sleeping on our side or stomach because we're going to use gravity to help pull the tongue back down out of our throat, okay? And that works for a while, okay? Probably worked for my first 30 years, okay? But later on, when I got older, even side sleeping didn't work as well as it used to. I got older, I got looser, okay? And so it didn't work quite as well. But if also, you know, you're asleep, you don't always stay on your back or stay on your side. So you flop over onto your back, then you have your apneic event, go through that terror, okay? Then you might wake up enough to get back on your side, okay? But we as a people figure out how we sleep best. So if you're a tummy sleeper, you probably ought to honor the fact that that's where you're going to sleep best, as a tummy sleeper or a side sleeper. But then there's compromises that go along with that. You're going to distort your face, push your cranial bones in on one side or the other. You're also going to round the shoulder over, okay? When I'm sleeping on this shoulder, it's here. I would like to have these shoulders back, okay? But when you sleep like this all night, it sort of distorts you, okay? Facial symmetry, sleep on side, round. So what we want is facial symmetry. If we sleep on our side, that rounds our shoulders, and it also messes up the facial symmetry, and it can create deviated septum, and it can create head tilts, okay? Ideally, our eyes should be even with the horizon, but a lot of us have our eyes cattywampus, okay? That sort of makes us crooked down our whole body. Tonsils and adenoids and allergies. Nasal breathing will help reduce tonsil size and adenoid size. So a lot of kids have big tonsils because they're not using their nose, okay? A lot of kids will have the tonsils out because they have airway breathing problems, okay? And it was good to get the tonsils out, but because their doctor didn't coach them to start becoming a nasal breather, the benefit of the tonsillectomy is short-lived, okay? So this is information that needs to be passed on. If you're going to get your tonsils out, you got to learn to breathe through your nose. Also, you might not have had to get your